Good afternoon. I'm David Bayada, CEO here at Bayada Home Healthcare. Today is Friday, June 12th, and this is your CEO update during the COVID-19 pandemic. As you know, we've reduced our frequency a little bit from what was originally daily, and so it does feel like I feel disconnected in a way, even though we're communicating and engaging more than we ever have. I really relish these opportunities to, at least through a camera, get to connect with each of you and share important updates about our response and progress through this incredibly difficult time. I wanted to start by turning it over to Nora Triola, our Chief Clinical Officer, to talk a little bit about all the feedback that we've gotten from you about PPE protocols and some of the adjustments we're making based on your really, really important and continuous feedback. Nora?
Thanks, David. And it's again a pleasure to be with you and to talk about, I think, another evolution in our commitment to keeping you as safe as we possibly can. As you know, we are always asking for your feedback in our We Heard You survey. And that feedback has been loud and clear. And you are requesting an enhanced level of protection as you go to care for the clients that you're servicing so beautifully. And so in combination with that and looking at our existing protocols, one of the reasons that we based our protocol on CDC was the notion that many clients could also mask themselves at times of client care so that they would add protection for our employees. And that in reality is happening more infrequently than we would like to see. We also know, as we learn more about this virus, is that it's behaving in a way that you can transmit the virus to somebody when you are asymptomatic. And so for these reasons, most importantly, because you called our attention to it, we have gone through a process of updating our at-a-glance tool. Learning from earlier opportunities, we announced this a while ago and have been preparing so that when the tool goes into effect, you have the supplies and equipment to enable you to be able to comply with the at-a-glance. So you'll note that on the release, there's a new date. That date is Monday, June 15th, and it is when this new at-a-glance tool goes into effect. And again, based on your feedback and our data, is leading us to change which is on any client care. You are now preparing yourself, instead of with a comfort mask, you're preparing yourself with a surgical mask. And you will use your comfort mask in the community to get to your home where you're providing the care, or your congregate living facility. And then you will take off your comfort mask and don your surgical mask. Those surgical masks are to be used and discarded at the end of that client care episode. So if it's a visit, when you leave your visit, you discard your surgical mask. Similarly, if you're working a shift, you discard your surgical mask then at the end of your shift. And always, if in fact that mask gets contaminated or soiled, you go ahead and change that mask out. There's also another important update in the at-a-glance tool dated 6/15, which is in client scenario B. And so client scenario B, we used to have a qualifier for face shield and goggles, which said for aerosol generating procedures. We'd like you to now use those tools, the face shield or the goggles, when you're entering client care scenario B and the client's being tested, asymptomatic, we're going to go ahead and wear our surgical mask, of course, because we as an increase from A to B, and we're going to wear the face shield or the goggle, and then the associated contact precautions of the gown and gloves. So those are the two big updates. We have a behavioral health carve out for A, and so the comfort masks will continue to be used in Hawaii in our behavioral health population, and you can see that in the yellow box under A, but those are the new changes to the at-a-glance tool for June 16th effective. You may have already started those. Many of our directors had supplies and began to distribute those. I'm sure by now you've gotten your supply, and we're trying to do that in an efficient manner so that there's less trips and logistics around having to move from the comfort mask to the surgical mask. But again, these are in light of data-driven decisions, your feedback, and our never-ending quest to keep you as safe as we possibly can. So thanks again for all your hard work in caring for our clients, and we hope that these additions to the at-a-glance tool will keep you even more safe as you do that great work.
Great. Thanks, Nora. Appreciate it. Thanks for the continued evolution and updating of all of these protocols to help keep our clinicians and our clients safe out in the community. I wanted to end with a great story about one of our clients in State College, Pennsylvania. This is Luke, and as many of you are probably experiencing at home, this is graduation time, and clearly a unique experience with all the virtual graduations that are happening out there. And some of you know that a really important service here at Bayada, specialty practice, is focused on providing nursing care to medically fragile children. And many of those children, many of those services are in support and accompaniment of those children as they go to school. Well, obviously, like the rest of America, school has been canceled. But even Luke here got to experience and participate and enjoy a graduation experience thanks to his nurse, Beth, and the support of the entire team at our State College Pediatrics location in Pennsylvania. So congratulations to Luke, thanks to Beth, and to the entire State College PA team. We'll see you next week.